How is male breast cancer detected? How is male breast cancer detected? This is an important question, especially since breast cancer in men is less common but can still occur. The detection process involves several steps that help ensure an accurate diagnosis. It typically begins with a clinical breast exam. During this exam, a healthcare provider will physically check the breast tissue, nipple, areola, and nearby lymph nodes, including those under the arm and around the collarbone. They look for any lumps, swelling, or other abnormalities that might indicate a problem. If anything suspicious is found during the clinical exam, the next step usually involves imaging tests. The most common imaging test for breast cancer is a mammogram. This is an X-ray that provides detailed images of the breast tissue. During a mammogram, the breast is compressed between two plates, which helps make any masses easier to detect. It's important to note that mammography is generally recommended for men who show symptoms or are at high risk. However, it may be less sensitive in men due to their smaller amount of breast tissue. In addition to mammograms, ultrasound is often used. This imaging test helps determine whether a lump is solid or fluid-filled, which can be crucial for diagnosis. In some cases, magnetic resonance imaging may also be used to provide more detailed images, especially if other imaging results are unclear. However, magnetic resonance imaging is less commonly used due to its higher cost and limited availability. If the imaging tests suggest the presence of cancer, a biopsy is the next step. A biopsy involves removing a small sample of breast tissue or cells, often using a needle guided by imaging techniques. This tissue sample is then examined under a microscope by specialists to confirm whether cancer cells are present. The biopsy can also provide information about specific characteristics of the cancer, such as hormone receptor status and genetic changes, which are important for planning treatment. Before any imaging or biopsy, the healthcare provider will take a detailed medical and family history. This helps assess risk factors and symptoms. The physical exam may also include checking for enlarged lymph nodes in other areas of the body to evaluate if the cancer has spread. In summary, detecting male breast cancer involves a thorough clinical breast exam, imaging tests like mammography and ultrasound, and a biopsy for a definitive diagnosis. A detailed medical history review is also essential to understand risk factors and symptoms. This comprehensive approach helps ensure that any diagnosis is accurate and guides appropriate treatment decisions. If you have concerns about breast cancer, it is always best to consult a healthcare professional for personalized advice.